Go.
My name is Orly and I'm an NP. I chose to be an NP because I always wanted to help people and work in medicine, and I thought it would be a great balance of work and life. I did not change my career or my major while I was an undergrad. I was a biology major throughout, and I was a chemistry minor. I made the decision to be a NP about my junior or senior year while I was doing rotations and shadowing at a plastic surgery clinic. I liked the connection that the PAs made with their patients, and I was able to do a lot more of the background work and make a lot more time for the patients than the physicians were able to. I went to school for my master's degree, and I went to Hofstra University for my undergrad. Other jobs that I had in my life before this, I worked at a finance firm and Starbucks prior to starting my master's degree. What is my workload per week? I work full-time, and a lot of times it's about 40 to 50-hour weeks. Right now, I don't work any weekends or holidays, which is really nice, but in my job before this, I was on call and did have to work some weekends when you cover your physician, or holidays depending on what the call schedule is. The average pay in Texas is anywhere above $90,000, which is really nice. What benefits can be expected in this career field? It's a really rewarding experience, and it's constantly teaching yourself and learning and being able to be better with new research that's coming out. You can really expect yourself to excel a lot in different areas of medicine if you choose to. It's nice because while you're an MP or an APP, you get to switch fields if possible, as long as the physician's willing to teach and train you. The benefits of being an APP provider over a physician is that you have the opportunity to work with lots of different people. You get a lot of opportunities to do a lot of training and teaching students, and I guess you get that in both professions, so it's kind of similar. What do I do on a day-to-day basis in this job? On a day-to-day basis, my job consists of seeing clinic patients, usually outpatient. We do get inpatient consults and rounding in the hospital as well, so I do see patients in both settings. It's also a lot of background work, prepping clinic, getting patients prior medical history records, getting everything organized for the physician for the day, doing a lot of patient calls, peer-to-peers, medication renewals, organization, coordination of care for the patients that are traveling or need to coordinate treatment for other physicians, referrals to outside practices, making sure that any other services that need to get done. People have a lot of medical complications, and so you need to make sure that everything's being treated as a whole, and you don't just see the patient for what they came in for and then forget about them. So as the PA, we kind of do everything and wrap everything up together. What are the 3 most important skills in this job? I would say willingness to learn and continuing to educate myself, organization, and patience. I do have a family, and is it a good work-life balance? I would say that I constantly feel that I don't spend enough time with my dog. I don't have any children yet, so I can only imagine what it's going to be like when I do have children. But I do, like I said, get weekends and holidays off, which is really nice because I get to spend time with my husband and see our families. What are 3 pieces of advice you would give someone who's in undergrad thinking about becoming an NP? The best advice I can give you is to get as much practical and clinical experience as you can. Sorry, I wrote a lot of this down because I wanted to remember it. You don't have to do a lot of overload for yourself as an undergrad, but you should make time to get that experience in while you can. And it's also useful because when I was getting my master's degree, I could look back on that clinical experience, and I already kind of know what to expect as far as charting, writing clinical notes, seeing patients, getting some experience starting IVs, all sorts of things. So I think that's extremely important. also all the clinical experience really helps when you're doing your applications, which is a major part of your application process too. So it's practical and it's useful. My second piece of advice is put effort into being the best that you can in something that you're interested in. If you think that medicine's a good career but you don't have a passion for it, you're going to be miserable. If you are interested in the field and you push yourself to excel and do the best you can, and you feel rewarded from it, then that's a good indication that you're in a field that you're going to be happy in. If you're doing it because you think the pay is good or that it'll be a good job but you're not really interested in it, it's not going to be rewarding and you're gonna hate it. It's a lot of work to get to where you have the skill set and you're able to fulfill the requirements throughout your master's program. And if you hate it, I've seen a lot of people that have started and dropped out because it's just not what they wanted. So make sure it's something that you're interested in. It's better to pursue something that you feel like you're going to be passionate about than to pursue something that you think might be a good job. My last piece of advice is to always remember that it's okay to step back and take some time for yourself. I studied really hard and had a lot of sleepless nights keeping up with my grades and making sure that I was top of my class, but I also remembered that sometimes it's okay to just go out and have fun and be with your family and be with your friends, because even though grades are important, your mental health is important too. Otherwise you'll just go nuts. I don't know if that's helpful or not, but those are my answers, and I hope that it gives some insight into being an NP and what you have to do to get there. And I do think it's worth it in the long run, but it's up to you.